Welcome to Discover Health. I'm your host, Dr. Tom Brea. Today we have another in our interesting series on creating good eating habits for all of us. In the past, we've had several programs where we've discussed eating habits in adults and how we've tried to prevent obesity, being overweight, and the natural consequences of that, which at least in terms of this program has been discussing diabetes prevention and treatment once the diabetes is started. Now, today, we are pleased to have two diet specialists from the Navajo County Health Department to talk to us a little bit about establishing good eating habits when we're young rather than having to play catch up when we're older. And to do this, we have Kendra Hook, who is a dietitian, nutrition specialist with the health department. And we also have Brea Lewis, who is a specialist in educating on obesity prevention. And I will say welcome to both of you today.
Thank you.
Thank you.
Okay. And you don't have to be nervous. This is really a fun time. And I'm not a young kid that you have to discuss this with, but talk to me a little bit about how the county health department approaches healthy eating habits starting from early childhood, I guess.
Well, we definitely agree that healthy eating habits and healthy nutrition as a whole starts very, very early, even in the womb. So our parents and caregivers are those very first teachers that we have for that. So we really team up and we go into daycares and preschools. We work with kids ages or grades K through 12, and we go in with various programs. They are curricula given to us by the USDA, and they are evidence-based, which is fantastic because they're proven. We know they work. And so we provide information on nutrition. We really talk about the 5 food groups. We talk about physical activity. There are lessons that are about portion control. We teach how to read nutrition labels. So we really like to cover all aspects of how to be a healthy person as a whole. But WIC is a fantastic resource that we utilize, and that is something that we also recommend and will refer to because that really helps us to get that nutrition started, healthy nutrition in the womb with moms all the way through the curriculum that we provide in schools.
So you mentioned prenatally, essentially. Do you have prenatal classes? The health department have prenatal classes for moms to go to before they're born?
We did.
Well, we actually have our WIC program. So we encourage pregnant moms to come in for our services, and we talk about prenatal care. We have daily food plans for moms to follow that are very easy for moms that don't know everything about the nutrition that they need.
So essentially an obstetrician sometime during the pregnancy can refer an expectant mom, to the WIC program.
Of course.
Absolutely.
And the WIC program does the WIC program, and so they just go there, sign up, and there are classes for these expectant moms, or is it really good and have one-on-one teaching?
We have one-on-one teaching with WIC, and actually something I'm looking into is getting my hands on a curriculum for multiple classes that can be given in a group setting. So that's something I'm working on right now.
So we could let the obstetricians know, and of course expectant mothers that might be watching this, that those services are available in the WIC program.
Yes.
And my understanding is that there is a considerable amount of research now about establishing good maternal eating habits so that children are born essentially not overweight,
Right.
not underweight, and that good feeding is established even before they're born.
Yes.
And that's part of the program that you go through with WIC?
Right.
Okay.
That's part of the program.
All right.
And that's also something, again, we reinforce in those schools. I work mostly with grades K through 12. And for instance, the program I'm working on right now is called Discover My Plate. And it's very, very focused on those 5 food groups. And we teach what kinds of foods are in the 5 food groups. And we do fun games to help them remember. And we actually had one of my team members said that one of the kids in her classes came up to her and said, I said I had to eat my vegetables because the nutrition lady said so. And so that was such a fantastic little piece of information that we got back, because it really, those are little things that help us know that it's actually making a difference and it's sinking in.
So let's start with the school system. You go into the grade schools in the entire area as a tag team?
We usually it's one educator per school.
Okay.
We have service areas. As you probably know, Navajo County is huge. It's a very, very large area. And so each of us have different service areas. And we will present our curriculum or our curricula to different schools, and if they say yes, we want to come on board with this, we welcome you to the school, then we're happy to go in there. I'm working with Whipple Ranch Elementary right now, and we're working with the kindergartners. So I go in on certain days of the week and certain weeks of the month, and I provide that education along with their PE teacher. That's who we're working with.
Okay, so that means that there must be other educators besides the two of you
Yes.
that are in the health department that have different schools and that are assigned to you. So let's start it. We'll if we have time at the end of this, we'll go back to the newborns a little bit.
Sure.
But since you started here with the school system and you're most familiar with that, tell me a little bit about the actual program that you start in kindergarten and the early years in grade school.
Sure. We have about 30 to 35 curricula that we actually have to choose from, again, from the USDA. They are age appropriate. So what I would do as an educator is I would look through my curricula once I understand what age or grade I'm working with, and then I would go ahead and select those curricula, the teacher or educator within the school, and I would decide which is best for that class. So for instance, the school I'm working with right now, Whipple Ranch, we went with the Discover My Plate curriculum.
Okay.
And this particular curriculum is split into 6 to 7 lessons, and they're 20 to 30 minutes each, because we're also, again, they're age appropriate, so you really have to take that attention span into consideration as well.
Sounds to me like a teenager.
Right. Or some adults.
Okay, I'll take credit for that too.
So we'll go in and again, it's very heavily focused on the 5 food groups. We also teach low salt, low fat, low sugar, and whole grains. So, and you can see some of that displayed here, and we'll move to that in a bit. But that's really what we focus on, is getting them to a place where they can think of healthier food choices or be able to recognize healthier options, because they do have a certain amount of say in their bodies. So, but we'll go in, and again, there's portion control. The really unique thing about where I'm at right now is I have the privilege of working with the PE teachers. So this is done in their PE class, and we get to modify the lessons to a certain degree to allow an amount of physical activity to be part of them remembering what types of foods are in the different food groups. So we'll do a game of tag or red light, green light that allows them to sort food cards with, there's a picture of grapes, a picture of green beans, a picture of chicken or potatoes, and they get to sort them in the different buckets that we have set out that are coinciding with the food groups. So that's one lesson that
So
we
one
would
of the
do.
ways you start out with young children is, of course, establishing the different food groups.
Yes.
So they don't get to throw the potatoes across the room into the bucket.
No, as much as they would love to. As
I'll
much
bet-
as I might love to, no.
I guess if you did that with tomatoes, it might be kind of messy.
It would get messy.
So you make a game out of teaching them the food groups.
Yes.
How do you teach portion control?
We would look at, well, we actually have several visual aids as well. For instance, I do have some posters that I hang of the 5 food groups, and the way the posters are divided up is an actual picture of a plate and then a smaller circle, which is indicative of a glass, and that would be our dairy group, so it's easy to remember a glass of milk. And the way the food groups are divided up on that picture of the plate is half of the plate is fruits and vegetables. So it would be even a quarter of fruits, quarter of vegetables, a measurement of grains, and a measurement of protein. And so we actually give them a visual so they can see half of their plate should be fruits and veggies, whereas, there are smaller amounts, more specific amounts for the whole grains. We emphasize whole grains and then proteins as well, and then your little glass of dairy. So visual aids is huge in teaching them portion control.
So what percent of people, general people, eat a meal where half of the plate is fruits and veggies?
Specifically, I don't know, but I would say a very small percentage. It's something that I've suddenly become very aware of.
I was just thinking that as I look at my own eating habits and what I see in restaurants, that the food that we serve in restaurants is not a half a plate of veggies and fruits.
Absolutely.
unless
That's
unless you order those specifically.
We learn as we teach as well.
Absolutely.
Yeah.
We definitely learn as we teach. And also I have a little one myself. He just turned a year old. And so I'm looking at what I feed him. And there are times when I'm like, I'm doing an awesome job. And there are probably more times when I'm like, I see what we need to work on. So it's very interesting to have both of those perspectives, one as an adult and another one as a mom, and being responsible for what goes on that plate and what type of portions are there.
Well, I think that's a consistent thing we've seen even when our diabetic educators have come to talk to us. They've talked about the fact that a half a plate needs to be green. Mm-hmm. They talk about half the plate needs to be green. They actually want more greens than anything else on the plate in terms of establishing. But they're worried more about weight reduction and carb control than anything else.
Right.
So in the young children, you go through that, I'm sure, and that's part of the learning process of the food groups. But as the kids get older, the issues are a little bit different, aren't they?
They definitely can be. Also, as kids get older, especially when you're talking about the high school age kids, the older kids in high school, now some of them are old enough to be able to have jobs, especially if there's like a work permit that can be signed. So they tend to have a little bit more control over what they eat. Kids that I remember when I was doing after school activities, and I had that weird 45-minute, 1 hour time frame between the end of school and then the beginning of practice. You want to grab something to eat. So Burger King was across the street, and this is in California. So it was real easy for us to go grab Burger King. But so I think that's one area where it's so important for us to really teach these healthy habits at such a young age so they become second nature. And like you pointed out earlier, so that you're not now into trying to reverse and bring something back. So
let me ask a couple questions.
Mm-hmm.
In the school systems, there's been a push about taking sugar-sourced drinks out of it, juices and stuff like that. Is the school system here in Show Low and surrounding areas in Navajo County adhere to these kinds of programs?
Yes,
They're starting to.
Yeah,
Yes,
I think it's
so.
really getting better. I was actually just speaking with someone who developed some software for Whipple Ranch. It's a school I'm most involved with right now.
Well, we understand that.
Yes, it's a very easy reference point for me. But there's actually the foods that they bring in, they're able to enter in the nutrition facts and the portion sizes for each meal, so they're able to see exactly, it's like they're seeing their own nutrition label for each meal they serve and how many meals are served, what the kids are choosing. So it's their own visual aid, it's their own marker, so that these foods can be kept track of. And then they can go ahead and make modifications as necessary. That's actually another facet. We have several objectives in the nutrition department, and one of those objectives does have to do with really going over the menus for the schools, and talking with the appropriate persons and really making sure that the kids are getting good, healthy nutrition in school.
And I'm sure that that all is there. But as you get older a little bit, we have to deal with junk foods.
Yes.
So when do you start teaching the kids about junk food junkies?
Actually, that's something that I've already talked about with my kindergartners. We talk about always foods, and then we talk about the sometimes foods. So we're talking about moderation with 5 and 6 year olds already. And one of our food cards actually is a small cup of ice cream. And one of the kids, we were sorting our foods in the appropriate food groups. And she said, "Isn't ice cream bad for you?" I said, "That is a wonderful question. It is in the dairy group, but how much sugar is in ice cream? Is that why we like it so much?" And then we get into a short conversation about always foods and sometimes foods.
Well, what's an always? Give us some examples of always foods.
Vegetables. Any veggie is going to be in always. You can always eat spinach or broccoli.
True.
It's delicious, right?
And with our younger kids, we have to be creative
Yes.
on how the foods are offered. We have a lot of picky eaters, especially with the young children that are going to daycare. A lot of times we see that they're being served their lunch and it looks weird, so they don't want to eat it. So we talk to the teachers and parents about being creative with our foods, making up different names for certain food items, not calling it vegetables so we're not scaring our children, learning how to make fruit smoothies and vegetable smoothies, and just making fun with your food. We also encourage moms or dads or the caretakers to let the children be involved in what they're making, so it's fun for them and it encourages them to eat what they're making.
In the past, we used to talk about parents about how to hide vegetables
Right.
in foods, and for example, putting spinach or green vegetables in spaghetti sauce.
Yes.
And to try to get it that way. And there's presumably a difference between eating cooked vegetables versus raw vegetables. A lot of children like raw vegetables better than they like cooked vegetables.
Yes.
And so there's a lot of opportunity there for teaching parents how to do that when they're younger. And then in terms of not so good foods, you called anytime foods and sometimes foods.
Yes.
So give us some examples of sometimes foods.
Happy Meals.
Yeah.
What?
Happy Meals at McDonald's.
Okay.
Sometimes food would be, again, like like a little bowl of ice cream. Again, that's where portion control is really important as well. No one needs to eat a gallon of ice cream. Nobody. Sometimes we don't even need to eat a pint, but we can have a cup every so often. And, we don't want to scare kids because kids go to birthday parties a lot, right? That's a really fun activity for them. So we don't want them going thinking, "I can't eat cake. I can't eat ice cream. I can't do this because it's hurting me." We want them to be able to have fun. We want them to have those experiences. So have a small piece of cake, have 1 scoop of ice cream rather than having a dome on your plate of these things. So portion control and moderation of these foods. We don't eat birthday cake every single day, but we can have it a few times a year when our friends are having a party.
And I think that's a really important issue to deal with, because we tell even diabetics who say, "I can't have ice cream," you can have ice cream, you can have this much ice cream, you just can't have this much ice cream.
Right.
And the portion control is a big issue that a lot of us have issues with.
Yes.
And you have foods here on the table.
We do. So this is an example. Go ahead.
Which one do you want to start with?
Okay.
Tell us what the foods mean.
So one of the things that we were discussing is having moms on the go. What can moms substitute for, instead of grabbing a bag of Doritos, what's a more healthier choice? You have your celery, you have your pretzels, and your peanut butter dip. This would be a more healthier choice.
Okay.
We also have a go-to for the kids' favorite is the goldfish. Instead of the regular goldfish, you can substitute with whole grain goldfish. And then instead of that quick soda that all the kids love, you might want to replace that with vitamin water. And you want to talk about your banana wrap?
Sure. As part of the curriculum, we actually do have food demos that we do with the kids, of course, time permitting in the classes. And one of our recipes it's very, very simple. We like to focus on simple for them because these are going to be snacks that, as they get older, as it's appropriate, they could be making for themselves at home. So we'll say use a whole wheat tortilla or wrap. Spread some peanut butter on there, and you can put a banana in there. You can lay it whole, you can slice it, and you roll that up, and that would be what they call a fruit roll-up, which is much different than the fruit roll-up that we're used to.
Than the commercial ones.
Yes.
And I noticed that these are whole wheat,
Yes,
and they still have a significant amount of calories in them.
they
but
do.
But they also have fiber in them too.
Yes, which is very important. And that's another thing we talk about is, for instance, one of our lessons is eating the rainbow. So you want to eat foods of all different colors because have you noticed that, let's see, tomatoes and strawberries and bell peppers are, they're all red. They're all the same color. That's because they have certain vitamins and minerals that make them that color. So fiber is one of these things that we talk about with the kids. You want to have a nice good amount of fiber because it keeps your system healthy and it keeps everything moving.
I like the keeps everything moving.
Yes.
There's been data in older people that shows that the higher the fiber in their diet, the less problems they have with things like colon cancer and stuff. And it's really important that everybody be able to read nutrition labels.
Yes.
And so when you tell a parent to look at a nutrition label, how are you trying to advise them for discerning what to look for on food labels?
I would advise look at the calories and then look at the calories from fat. If a significant portion of the calories in the total food are from fat, maybe let's pick a healthier option. Maybe let's look at what else is around and make a different choice.
So, and that really makes a big difference and stuff
Huge.
like that. Mm-hmm. Do you talk at all about calorie counting or anything to give parents an idea?
Not specifically in the classrooms. We don't want, we also don't want to create the opposite problem in having kids be completely focused, hyper-focused on calorie counting and label reading. We just want to create an awareness of how they eat and how they could eat, or if there are any changes that they didn't know they could make that now they're aware they can make on their own.
So I see that the school-based program is really teaching them a good start by giving them the idea of the food groups, trying to teach them that foods aren't necessarily bad. You just have to control the amount that you eat, moderation.
Right.
Most parents think that the jolly, chubby young child is a healthy young child. And so that's not necessarily true, is it?
Right. I remember actually when I was getting ready to have my child, everyone said, "Oh, I hope you have a chubby baby. They're just the best." So there definitely is that perspective. But I think so many people are aware of different body types, and that doesn't happen as you grow. We all have different body types out of the womb, which, that is also evidence-based, I would say. But with these body types, I think it's very important to pay attention to and listen to the child's cues that they're giving, because these are all involuntary. They're not necessarily, they don't have the awareness yet to say, oh, well, I'm going to eat emotionally right now. So
Right.
I would like some more pasta, please. That's not something that they're necessarily going to do. So
It comes down to that caregiver being educated on portion control, consistency, not letting the child overeat, and having the resources available to those caregivers so that they can get the information.
Well, I think it's interesting, your concept of forever foods. I mean, even in young childhood, teaching a child that they can have this type of food as much as they want, but that type is really not very much. I mean, from my standpoint, one of the big issues that I see is that parents use food as a reward. And typically, the foods that kids get as rewards are those not too much foods.
Right.
So are there programs for toddlers and parents in town? Where might a parent go to get this kind of discussion?
You can always call the health department, Navajo County Public Health Services District.
Okay.
And we can provide information that route. You can contact Head Starts.
Head Start, you guys go into Head
Yes,
Starts to
we
teach
do.
And we
that?
encourage the parents to come down when we're going into the classes to be a part of that, so that they're getting the information that we're giving to the teachers and the children.
So you go into the Head Start program. Does the health department have any scheduled classes, like for example at the health department itself right now, or is it mostly outreach
It's
program?
Outreach.
mostly outreach in the schools, daycares, Head Starts. But I'm actually working on doing some other classes for the community in general, all ages. And that might look like having something at a community center, at the health department, something like that. It's not happening yet, but it's a possibility.
It sounds like the health department has a broad program.
Yes.
And certainly a simple call to the health department might find it to your most available for everybody. I know there are not a lot of classes, prenatal, not necessarily prenatal, but postnatal classes in the county at all for teaching parents how to eat. And you might not realize this, but we're almost out of time here.
Okay.
And it's important for people to understand that the health department has a focus on feeding well. The health department, your kids are getting it at school. And we thank the two of you for coming here and telling us about the programs.
Sure.
As you can see, eating is a big part of our lives, and we hope that you understand eating moderately, well-balanced diets, lots of greens on your plate, is the way to go. And I would say to you, thank you for watching, and have a healthy day. Thank you.